Hello and welcome to this podcast from the Coalition for Life Course Immunisation, the CLCI. My name is Gary Finnegan and I'm the editor of Vaccines Today and also a trustee of the CLCI. This series delves into the crucial issue of life course immunisation and the pivotal role that it plays in achieving global health goals, particularly at a time of population ageing, climate change, geopolitical crises, and rising healthcare costs. Today, we're joined by Professor Mark Jitt of the School of Global Public Health at New York University to talk about how economic modelling of vaccines can support evidence-based public health decision-making. Dr. Jitt, Professor Jitt, I should say, has served on expert advisory committees in the UK as well as for the WHO, World Health Organization, and his work has influenced many of the major changes in immunization policy in countries around the world. Mark, welcome to the podcast.
Thank you. It's great to be here. Thank you for inviting me, Gary.
You might be the first mathematician that we've had on, so it struck me that I should ask you what got you into vaccines of all things.
Well, I mean, my initial education, my degrees were in mathematics, but I think the work I'm doing is on the very, very, very applied end of mathematics now. I did a first degree in mathematics and then a PhD in mathematical biology. But one of the first jobs I got when I was looking for work after my PhD was with what was then called the Health Protection Agency. It's now, changed a few times and is now part of the UK Health Security Agency, the public health agency of England, really at that time. And the job was really using mathematics to understand the impact and the economic implications of vaccines. And I was thinking, that sounds incredibly interesting, like really relevant to daily life, but also using really interesting mathematics. And so I got the job and I really loved it. I said, this is what I want to do. This is really interesting.
Well, it's only become more interesting, I think. So I hope you're glad that you, didn't follow classmates into banking or wherever else mathematicians end up, or teaching, or goodness knows what. But let's talk a bit about modelling then and how vaccines are evaluated. I know you've looked at everything from how diseases spread and the prevention of those diseases, and even the cost effectiveness of vaccination. So, how do we know which vaccines are good value? And what's the role of modeling in those decisions?
Well, I would say, first of all, vaccines in general are incredibly good value. In fact, they're one of the best value public health medical interventions that exist. The vaccines we've had for decades, the vaccines that protect us against measles, for instance, or whooping cough, or, rubella, German measles. These are, some of the best interventions. A number of years ago, it was the 50th anniversary of what's called the EPI program, the program that the world came together and said every country should introduce these vaccines. And an evaluation was done, finding that actually these vaccines have saved hundreds of millions of lives. They probably have saved one life every 6 minutes, these vaccines that have been introduced over the last 50 years. The more challenging thing is that we're getting newer vaccines, which are also saving many lives. Over the past 20 years, we've had vaccines that protect us against, we saw during the pandemic, COVID, against RSV, another respiratory disease that, really puts a lot of children in hospital, against lots of diarrheal diseases, for instance, against cervical and other HPV-related cancers. And these are great vaccines that save lives too, but these are much more expensive because they've just been developed. So countries need to make difficult decisions about, can we afford to introduce these vaccines? They'll save lives, but they'll cost us a lot of money. And that's where the economic evaluations, working out, are these the best use of our limited resources? These are where countries have to make the hard decisions, especially in the, current climate where budgets are tight and there are lots of hard decisions to be made.
And I suppose you mentioned, of course, disease prevention is one of the big benefits. And for, I guess, things like smallpox, it's basically infinite benefit because the disease is gone. So everyone forever from now on will be protected or will avoid that disease. But what about kind of the other non-health or health sort of tangent side issues, let's say things like preventing hospitals from filling up, or preventing parents or even adults caring for their own parents, the sort of caregiver roles. Are those things being factored in when you try to estimate the wider impact of a vaccine?
Yeah, these are all very important too. I mean, there's the lives that vaccines save, and actually, the good thing is that the diseases that in high-income countries such as the UK and US used to unfortunately, kill many children and adults, and the ones who survived from diseases like polio often were disabled for the rest of their lives. I mean, most of these diseases have been eliminated or reduced to very low levels of incidence. They're very uncommon in richer countries. That's not true everywhere in the world. So there's still so much work to be done to, make sure that a child born in a country that's not as rich as the UK still has the same life potential, the same life opportunities, because they don't get these terrible diseases as a child born in the UK. But really, now we are also looking at diseases that might not necessarily, cause a lot of deaths, but actually put a lot of people in hospital. For instance, a number of years ago, the UK introduced a vaccine against rotavirus, a diarrheal disease that, does not has a very low mortality, but lots of children, very young children, get it. They need to be brought to hospital to be rehydrated. They're there for a night or two. Parents are really worried. They're there in winter, so the beds, are filled up. So this is a very useful vaccine, even though it might not save a lot of lives. It has, saved a lot of parents from a lot of anxiety, lost work. It has freed up a lot of beds in hospital in winter, so that the people getting, like other like flu, old people getting flu and things like that can be hospitalized. Yeah.
And is it possible to capture some of those things when you're making the calculations?
It is. I mean, these are sort of outcomes that can be captured. I mean, different countries are interested in different outcomes, and so they include different um, sort of outcomes within the economic evaluation. In the UK, there's been a decision that the costs that will go into an evaluation are those that fall on the healthcare sector. The argument being that the money allocated to the NHS is there, to save lives and to improve health, not to sort of necessarily benefit the wider economy, even though we know it has these benefits. So the decision should be made on how much health we're buying rather than the wider economic impact. But in some countries, the evaluation is also done considering the wider economic impact. So if someone doesn't have a disease, they're able to work, and that helps the economy. Or if their kid is not sick, they don't have to miss work to take care of the kid. So that has great benefits to the economy as well.
And so, is the tendency then in some countries, and you mentioned the UK, just to look at it, it's health only, basically. It's not even necessarily social welfare payments that might come due to disability, and it certainly isn't lost productivity. Is that the way they look at it?
Yeah, well, usually the what's looked at is the impact on the NHS, and sometimes on, social services as well, because that's what the Department of Health and Social Services
Ah,
budget is addressing.
okay. And is there any difference when these calculations are made, especially thinking about life course immunization, when evaluating a vaccine, even a relatively expensive one, for a younger person compared to an older person? Some of the pneumococcal or shingles vaccines and so on, typically given to quite older people. Maybe they have fewer years of productivity in an economic sense to give. But does that affect the equation when those calculations are made?
Well, there are a whole range of different considerations when doing these evaluations. There's the effect on, health and life. I mean, if you save the life of a child, that's of great value because you're saving many years of life that the child could have lived. When it comes to an acute disease that doesn't result in death, that it doesn't matter whether it's a child or an adult or a young adult or an older adult. That's maybe 7 days in hospital or 7 days in bed is worth the same amount. When it comes to productivity costs, for instance, those are not considered in the UK, but in other countries where they are, those might be different in different age groups. So obviously, if it's a adult, then that's someone who could be working, and so that's loss of productivity if they are, in bed instead. If they're, if it's a child, someone probably has to take care of the child and might miss work as a result of having to take care of the child. If it's an older adult, then sometimes they're not working, but there's also a lot of work looking at, well, what is the impact of what is the sort of benefit that older adults actually bring, in terms of, for instance, child caring responsibilities that they take on, usually unpaid, in terms of often there's a lot of voluntary work they do in the community that older adults do, which we aren't so good at measuring, but people are increasingly saying, well, older adults play a vital role in families and communities, and that's not sort of, sometimes it's directly paid work, sometimes it's not, but we need to be able to capture the value of that too.
Okay, yeah. So that's the kind of positive contribution as well as
Right. Yeah.
avoiding the sort of negative side of them
Yeah.
being sick.
Yeah.
And when it comes to modeling things like herd immunity, or the general benefit of reducing the spread in a community, this is this something that you look at quite frequently?
That is a really one of the great benefits of vaccines. Many vaccines is that they don't just protect the person who's getting vaccinated; they also protect the wider community. So there's some people who might not be able to be vaccinated because they're too young, or because their immune system doesn't protect them even if they get vaccinated, but they can still be protected because the lots of people are vaccinated in the wider community, and that is definitely a very important part in assessing the value of a vaccine.
And do you think, returning to life course immunization again, that it has taken time for decision makers to make that shift to thinking about the value of vaccines at all ages, compared to the more traditional, infant immunization programs that everyone more or less is familiar with and accepts?
I think in the UK, I mean, we've had ad adolescent and adult vaccines for a long time now. I mean,
Mm,
like for decades now. I mean, we've had vaccines against flu for older adults, pneumococcal vaccines for older adults, HPV vaccines for adolescents for decades now. So it's I think this is not new. In some countries, I think most vaccines have been given to children. So for vaccines for adults, there's the question of how are you going to deliver these vaccines. There's already a
mm,
a system set up to deliver vaccines to children. Infants come to get vaccinated, and for a range of other things like like maybe checks about their nutritional status, nutritional supplements, deworming, and so forth at regular intervals when they're very young. But old adults don't come regularly to to clinics for the same reason. So, countries do have to think about how are we even going to deliver these vaccines. I mean, COVID showed us that it is possible. I mean, lots of countries that had never delivered an adult vaccine were able to vaccinate large percentages of the entire population of all ages with the COVID vaccine. So it does show that it's possible, but obviously that was a real crisis. So a lot of, extra resources were put into it.
mm. And do you think in when decisions are being made around these types of things, that preventative measures like vaccination uh, are viewed differently to treatments? There are some quite expensive, I don't know, diabetes or even obesity treatments at the moment, which can make the case that they save lives on heart failure or heart disease and so on. But as you said at the top, one of the best value interventions seems to be vaccination. But my question is, are they viewed differently?
Yeah. I think that is true, and that's true of many public health preventive interventions. I mean, I guess it's the immediacy. If you see someone in hospital and they are dying and you can save their life, you say, well, we do have to give them this drug. It will save their life, right? Just like if you see someone drowning in a river, you're gonna say, let's rescue the person. With a vaccine, you are gonna save someone's life, but you don't know who it is. You can't say, well, I'm gonna save, um, person X's life. It's a invisible life, but someone is not going to have their lives saved in the future. But because there's not that immediacy and that sort of like tangibility that you can see exactly who you're saving it, I think preventive interventions like vaccines tend to get somewhat overlooked psychologically because of that.
And is that perhaps the value of breaking things down to mathematics and just showing the data and pointing at numbers instead of emotional factors?
I think that's exactly it. I mean, there is a place for these emotional factors. I mean, if people say, we've got to save that person's life. I mean, I think there was a example of a couple of miners in Chile, like a number of years ago, who were trapped in a mine, and the Chilean government spent, millions of dollars trying to rescue them, and eventually succeeded. And like the Chilean government said, this cost us a lot of money, but every single peso was very well spent. And that's because, well, there were these people, you knew them, they're trapped in the mine. If you didn't do anything, they would just suffocate and die. So I think there's a place for that, but also we shouldn't forget that actually we do need to remember that, people's lives will be saved in ways we don't know if we give them a vaccine, because they'll just go on and live normal lives. Without the vaccine, not only people's lives will be saved, but, people will be saved from, really having horrible episodes of disease, maybe disabled for life. So we do need actually the analyses, the mathematical and economic models to say, well, you're never going to see this, but actually you are going to, improve lives in so many ways if you are able to introduce these vaccines. And that's the reason, children and adults have are much healthier today than they were, say, 100 years ago, when, like some large percentage, maybe 10% of children never reach their first birthday because they would die of infectious diseases that now are rarely seen in places like the UK.
As you say, the problem, so to speak, from a communication point of view, is that we don't know which ones. It could be me or you or someone else. But
exactly, yeah.
So finally, then, for modelers like yourself who are working in this area, what are the big questions on your plate? What are the things that you're tackling at the moment on the vaccines space?
Well, I think the vaccine world is in an exciting place. There are many new vaccines being developed, which hopefully will prevent diseases that, are really devastating. I mean, we're seeing probably better vaccines against malaria, against tuberculosis on the horizon. We're seeing vaccines against, a vaccine against RSV, which has, as I said, put a lot of children in hospital around the world. So the challenge is that, the world's economy is not in a great place, whether we're talking about the UK or whether we're talking about um, c- countries with a lot less money, low and middle income countries, which especially low income countries are struggling right now in terms of healthcare budgets. So there are some really hard decisions that need to be made. We have these vaccines, they can save lives, but we can't afford all of them. How do we best use the limited amount of money we have available so that we can, improve the world as much as possible? And I think infectious diseases, I mean, we've prevented so many of them, but there's still going to be more, and there are bigger challenges ahead because of climate change, because of antimicrobial resistance, because of the emergence of new diseases. There are going to be bigger challenges and an even greater need for vaccines and hard decisions about how do we best use the resources we have to develop the right vaccines as well, and then to make sure that they reach the people who need them the most.
Great. So evidence-based decisions about these evidence-based interventions. Fantastic, Mark. Thank you so much. We'll leave it there for now. Thanks so much for joining, and to everyone who watched or listened. Don't forget to subscribe and make sure that you get the next episode as soon as it's out. But for the moment, from me, thank you and goodbye.
Thank you. It's great to be with you.